Thank you. Lisa McShane from NCI.
Okay, I have several points I'd like to make, and the first one really is following up on Rich Schulze's comments about the degree of regulatory oversight of these computational algorithms. And you know, as Rich very clearly described, it doesn't quite fit into our usual regulatory frameworks, so we do rely on things like NCCN evaluations. The concern I have with that is that the NCCN evaluations largely rely on published literature. And I do have concern, and I gave some examples in my talk, about the validity of some of the things that you find in the literature. So I think that we need to be thinking a little bigger about how we might find alternative mechanisms to really give good evaluations of some of these algorithms. I'm also concerned about the fact that any of these algorithms rely on certain input variables. And if those input variables, for example, are coming from assays, which are versioned over time, how does that affect these models? As people mine more data and decide that, well, they could tweak their computational algorithm a little bit and it should work better. You know, how do we evaluate those kinds of things? I'm concerned there can be drift and we're never going to know it. So I think that needs a whole lot more discussion. Some other issues, you know, everybody's talking about data, you know, coming from the NCI, you know, we have efforts to try and set up databases, but let me tell you, it's very difficult for a number of reasons and it requires a lot of resources. And I'm not saying that to moan, but I think that we have to appreciate that if we want good quality data and we want to really capture a lot of data, somebody has to pay for that. And it was also made a point yesterday that even the preparation of a data set to put it into one of these data archives does require time and resources, and we are not paying well for that. So those are some of my big comments. The other comment that really wasn't discussed so much, although it was touched on a tiny bit by a few speakers, is this issue of going back and looking at patients who, for example, may have had a severe toxicity or who had an exceptional positive or negative response to a drug. We tend to think of these computational algorithms as, okay, we have all this data, we build our algorithm and we're done. But I think that these large data sets that we can accumulate can be extremely valuable for things that are not easy to study prospectively. Some of the disparities kinds of questions would be one example. You know, toxicities, really severe toxicities. I mean, my mother died of a severe toxicity of a drug after having gotten 2 doses of it. So, you know, there's got to be something in her genome that would have told us why that happened to her. And so I think there's a lot more we can do. We know even with immunotherapies, there are people who have rapid progression as soon as they get immunotherapies. Can we figure out who those people are? So I think that we have an obligation to not kind of consider our job done just when we've put out our first computational algorithm. We need to be able to go back to those data and you know, obviously getting the right kinds of consent, as Devin was talking about, will be important to allowing us to do that.